Welcome to the Thrive Forever Fit Show, the podcast that's here to ignite your potential and guide you on a journey towards living your best life. I'm your host, Jay Nixon, and I'm thrilled to have you with us today. On this show, we're passionate about one thing, and that's helping you reach your full potential, whether that's in your health and fitness, relationships, career, or personal growth. We're here to provide you with tools, strategies, and inspiration to thrive in every aspect of your life. Each episode will dive deep into topics that matter most, featuring insightful interviews with experts, thought leaders, and individuals who've achieved extraordinary success. Together, we're going to explore powerful mindset shifts, nutrition and fitness strategies, effective goal setting, mindfulness techniques, and much, much more. We'll break down the barriers that hold you back and help you build resilience, focus, and unwavering determination. So if you're ready to unleash your potential and embark on a transformative journey, this podcast is for you. It's time to embrace your inner fire, tap into your limitless capabilities, and make every day an opportunity for growth and self-improvement. Get ready to be inspired, motivated, and empowered to live the life you've always dreamed of. The Thrive Forever Fit Show is here to support you every step of the way. Let's dive in. Before we dive into the show, I want to take a quick moment to talk about the sponsor of this episode. It is very dear and near and close to my heart because it is Lori's company, SpaStar. If you ever had the opportunity to watch someone create something from a thought or a vision and make this magical thing actually come to life, well, then you'll know why I'm so extremely proud of her and why I'm so excited to have her sponsoring the Thrive Forever Fit Show. If you've listened to my podcast, then you probably heard her on episode 259. If you haven't heard that, I would go listen to episode 259 as soon as you finish this episode. She talks about the story of how she created it, the adversity she overcame, the challenges that she worked through, and just the inspirational story that I know you're absolutely going to love. But what SpaStar is a luxury wrap. And it was created as a spa wrap for people who were getting beauty treatments. But what we found out is it is a piece for everyday life. People are wearing it as swimsuit cover-ups, resort wear, just to get ready in the mornings or for that special event. It is the most unique piece. And I've actually worn this thing several times. I was the actual first model for this. Maybe I'll show you guys some photos of that when the time is right. But it is such a cool creation called the Get Ready Wrap by SpaStar. And because you're a listener, you get 15% off today because you support me. So just go to spastar.net, the word spa, the word star.net. And at the checkout, enter Thrive15, THRIVE 15, and you're going to get 15% off of your Get Ready Wrap. So many of my clients already have these and absolutely love them. We're selling them all over the country and all over the world, for that matter, to high-end luxury spas and to people just like you that are using them inside of their own homes. They're traveling with them. They're using them at the pool. It's so really just unbelievably cool to see and witness. And I'm so blessed to be a part of it. And I'm so blessed to have Lori actually sponsoring my podcast, which I think is really, really cool. So go check out SpaStar. I know you're going to love it. It is the coolest thing ever. And guys, this isn't just for ladies. This is one of the coolest gifts you could get any female in your life, for that matter. If Lori hadn't have created it, I would buy them for her as a gift to show her my love and appreciation. So dudes, if you're listening and you need to get a gift for your significant other or some special person in your life, go to spastar.net, grab a Get Ready Wrap. There's all kinds of colors. There's black, there's sage, there's a berry color, there's a gosh, I just went blank. There's a kind of a greeny, kind of avocado-y color. Really cool. You're definitely going to love these, I promise. So go to spastar.net, check it out, support Lori. And Lori, thank you for sponsoring the show. All right, let's get to the action. I am super excited about today's episode, guys. We've got Dr. Anshul Gupta. He is a best-selling author, speaker, researcher. Most importantly, he's a world expert on Hashimoto's disease. He's educated people around the world and across the globe on how to reverse Hashimoto's disease. He's written a book called Reversing Hashimoto's, a 3-step process for losing weight, ending fatigue, and reducing brain fog. He's worked at the Cleveland Clinic with Dr. Hyman. He is one of, if not the leading voices when it comes to thyroid issues, thyroid disease, and most specifically Hashimoto's disease. I am in for a treat today because this stuff just gets me excited, and you guys need to pay attention. This is one of the top subjects that I get asked throughout my program when I go speak. Everybody wants to know, how do you reverse? How do you prevent? How do you handle Hashimoto's disease? Today, we're going to get all those answers. I'm super pumped. Here we go. Dr. Gupta, welcome to the podcast. Thanks for showing up today.
Oh, absolutely. It's my pleasure. You're doing amazing work. So it's my pleasure to be part of today's episode so we can talk about, such an important topic of thyroid and Hashimoto's.
I was just telling you before I hit record, I get a question about the thyroid probably 10 to 20 times a day. And then more specifically, when it relates to Hashimoto's disease, like somebody either says, I think I have it, I got diagnosed with it, but there's all this like confusion around it. And then the next phase is like, well, what are you going to do now? And they're always like, I don't know. So before we dive into that, tell me a little bit about yourself. Tell me a little bit about your background and how you kind of got into this whole thing.
Absolutely. So my background is that, I am a traditionally trained family physician. So after just completing my residency of family medicine, just a couple of years, I started doing private practice. And a couple of years into my practice, I started having a lot of health issues of my own. I started gaining a lot of weight. Even though I did not change my eating habits or my exercising habits, I was having horrible, horrible stomach issues. This random stomach pain, which will just hit me any time of the day. It doesn't matter what I eat, what I do. And I had no idea what was causing it. Then I was brain foggy at the end of the day, feeling like, okay, well, I cannot just function or concentrate on anything after I was done with my clinic. And I was very tired to the point that during the day or during my lunch hour, I will try to sneak in a nap just so that I can function to the rest half of the day. So all of these issues were happening and I could not figure out what was going on. Especially the stomach trouble was bothering me the most because even like middle of the clinic, like suddenly I will have this pain and nothing could get it better. So I thought it was acid reflux. I started taking acid reflux medications. They did not help. At one point, I thought I'm not a smart doctor. Maybe I need to see smarter doctors than me. So I started going to three specialists. So they started doing endoscopies, colonoscopies, ultrasounds, blood work. Everything was normal. They had no idea what was going on. And they added more medications just to see that works. Obviously, that did not work. I was only 32 years of age at the time and I had no clue what was happening. And I was just miserable. I was suffering. I was without any hope of getting better. That's where, like somebody said, well, why don't you try functional medicine? They actually have people like you who have no hope and nobody can help me and they get better. So I started training into functional medicine, looked into that, got certified into it, and then applied the protocols on myself. I found the root cause of my problems, made a stepwise plan of addressing the lifestyle issues, taking supplements, and bingo, my life changed. Within 1 month, my stomach pain was gone.
Oh.
Within 6 months, I was off all medications. I lost more than 40 pounds during the time and had so much energy that I even participated in a 5K rugged maniac. And for me to do that was a big thing because I was never an athletic person. So for me to participate and do that was a big issue. So
Wow.
that was a life changer for me. And that time I realized I need to share this with people because this is big, within few months, my whole life changed. So I got this opportunity to work at the Cleveland Clinic functional medicine department alongside Dr. Mark Hyman because he was trying to do research in functional medicine model of care and I wanted to contribute. So I started working over there and slowly I realized I was attracting some kind of patients which had very similar issues in mind. They were all middle-aged females. They had weight gain problems. They were all tired. They had brain fog. They had gut problems. And one thing was common. They all had Hashimoto's disease. And they were all following what the doctors wanted to do, taking medications, but still not getting better. So I quickly was able to resonate with them. And I started like, okay, well, I need to research why is these Hashimoto's females are not getting better. What can I do? So a couple of years into my research, I figured out there are root causes playing a role. I made a program to see that works and implemented that program in thousands of females, got great results. Not only their life got better, but their thyroid numbers were getting better. They were getting off medications. So we were getting great results. So that prompted me to kind of share this with even wider audience. And I wrote a book about it, Reversing Hashimoto's,
Wow.
so that, people can read about it and kind of know what is Hashimoto's and how they can get better.
That is fantastic. I mean, I hate that you had to go through that to get to this, but I mean, there's probably thousands and thousands, if not, more people that are happy you did because, you've been able to help so many people. I have so many questions. What is the association? We're going to dive into like what is Hashimoto's and all that. I've never really heard somebody put the stomach issues in correlation with the, the fatigue and the brain fog and the weight gain. What's the association there? How and why is the stomach affected? Is that a normal trigger that most people know? Because most of the time somebody has a stomach issue, they're just thinking strictly GI. Like I've got an ulcer, I've got some kind of gastrointestinal, blah, blah, blah. They don't associate with the thyroid.
Absolutely. So there are multiple ways actually GI or gut affects the thyroid or like your body. So first of all is that, say something called leaky gut. Okay. So leaky gut is a very important concept which came into being like, a couple of years ago after the research that showed that leaky gut can be an important association with autoimmune conditions like Hashimoto's disease. So kind of for layman people, like basically leaky gut, is a condition, like your gut is lined with like trillions of cells. And all of those cells are kind of connected with each other. So in leaky gut, those cells becomes leaky, that the connection between them becomes leaky. So things, which are not supposed to pass from our gut in our bloodstream start getting passed on. And that actually starts this process of inflammation and autoimmunity in our body. So leaky gut is a very important aspect. That's the first way how gut actually affects our thyroid, by causing inflammation. The second aspect is that if our gut is not functioning good, if we are not able to properly digest our food and not absorb the nutrients, then our body gets low in different vitamins and minerals. Now, thyroid needs several vitamins and minerals to produce thyroid hormone and also to convert thyroid hormone properly. And if you are low on these things, again, that doesn't function and ultimately that leads to that problem. So that's the second way. The third way is that, we have trillions and trillions of bacteria that lives in our gut, right? We all know about these probiotics and all these good bacteria. Now, what we see is that, there is especially in people with thyroid disorders, their gut microbiome is not in perfect shape. There is something called dysbiosis or SIBO, where there is more bad bacteria as compared to the good one. And there is a direct correlation with overgrowth of bad bacteria with causing inflammation in the body, causing brain dysfunction, causing tiredness, all of those things. So these are multiple ways how gut actually affects the thyroid. And so, as you said, most people cannot put this two and two together.
Right. Right. So let's answer the question. What is Hashimoto's disease? Like what's the clinical definition of it? And yeah, just what is it?
Absolutely. So Hashimoto's disease, is an autoimmune condition of your thyroid gland, where basically your body starts producing antibodies that starts a very, very slow destruction of your thyroid gland. And this destruction kind of, can start at any point in the life, and it can take weeks to months to completely destroy the thyroid gland. Now, most people get diagnosed with Hashimoto's disease when the thyroid is not able to produce enough thyroid hormone to keep up with the demands of the body. And that's the reason they get diagnosed with hypothyroidism.
Okay.
And the unfortunate part is that most people, when they get diagnosed with hypothyroidism, they don't get further diagnostic test to actually check whether they have Hashimoto's disease. What is the reason of their hypothyroidism? And they don't get checked for Hashimoto's disease. So it is very important once people get diagnosed with hypothyroidism that they should also do a test to check whether they have Hashimoto's disease or not.
Is there a specific test? Like if you go to your doctor, you're like, hey, I want a specific test to see if I have Hashimoto's, or are they just looking at different like T3, T4? Are they just looking at those different markers?
No, there is specific tests. So again, let's kind of quickly go through these thyroid testing. So again, people have an idea. So the most common test, the only test that a regular provider will order is a TSH, thyroid stimulating hormone, right? And that's the only test people will get whether they have a thyroid condition or not. If your TSH is high, that means you are low thyroid and you get diagnosed with hypothyroidism. So first of all, it is very important to get a complete thyroid profile that includes TSH as well as free T4 and free T3. Now, this is just giving you a big overview of where your different thyroid hormones are, but this is not checking for Hashimoto's. For Hashimoto's disease, you need to get specific thyroid antibody levels checked. The two antibodies are, one of them is called TPO, which is the thyroid peroxidase antibodies, and the second one is thyroglobulin antibodies. Now, if any of these antibodies are higher than the reference range that is given by that particular lab, that is diagnostic of Hashimoto's. You do not need to get any other further testing of like biopsies or ultrasounds or anything. Just presence of antibody itself prove it. And the good part is this, the same blood draw that people are getting to get their thyroid hormone checked, same labs can also run these tests. You just need to ask your provider to, like run these tests so that you know what's going on.
Is it pretty standard protocol? So say, a client comes to you, they get their just normal blood, they get their normal blood draw, you test for the TSH, the TSH comes back out of range. So you diagnose with hypothyroidism. Is it standard protocol for the industry for you to say, hey, I'm going to have this test run on you? Or is it the patient's responsibility at that stage to say, hey, doc, I'd like for you to run these? Because what I see in my world as a nutritionist and somebody who tries to help people lose weight is there's kind of a stopping point. They get the TSH, it's out of bounds, and then it's immediately to medication without the next step of the test. And in my brain, as somebody who's been trained in the medical world for 30 plus years, my brain is like, we need more information before we go to medication. So why do you feel that there's that stepping point, and then whose responsibility? And I know that's kind of a loaded question, but how should that conversation transpire?
So the conventional way of looking at things or looking at thyroid is that there is no medication for them to treat Hashimoto's, right? So there is no medication to treat any particular disease. Why to even check for it, right? That's their understanding.
Okay.
So they can only treat hypothyroidism. So even though you have antibodies for Hashimoto's or you don't have antibodies, their protocol is not going to change.
Okay.
If your TSH is not affected, they cannot do anything. They're just going to say, come back in 6 months. We're going to check your TSH. Once your body or your thyroid is destroyed, we are going to start you on this medicine. Before that, we cannot do anything.
Okay.
So that's the reason they don't check it. But for us, it is very important to know whether the person has Hashimoto's or not, because through our protocols, we actually can improve those antibodies and stop that destruction of the thyroid, which is happening. Now, this is the thing most people don't know. When they're actually taking the thyroid medicine, even though they have Hashimoto's disease, they think that thyroid medicine is helping their Hashimoto's. That is not true. The thyroid medicine is only supplementing your thyroid gland with external thyroid hormone. It is not doing anything to support the autoimmune process or reducing antibodies or reducing inflammation in the body. It is not doing anything. You are just letting your body destroy your thyroid gland slowly and slowly. And that's the reason most people with Hashimoto's, they will start at a very low dosage of 25 or 50 micrograms of the medicine. And slowly that keeps on creeping up at 75, 100, 125 because their thyroid is destroyed. So it is very important for people with Hashimoto's to do things so they can safeguard the thyroid gland today. So first of all, they can feel better. And second of all, obviously they can safeguard this thyroid gland so they don't have to take more and more medicines.
So this is the reason why somebody goes through that process. They get diagnosed with hypothyroidism, get put on the medication, and they just keep getting worse and worse and worse and worse. They keep gaining weight. The brain fog doesn't go away. They're still fatigued. And I see this all the time. And I'm so glad we're having this conversation. And they come to me and they're like, Jay, I'm on the medication. They've increased my dose. I'm doing this, I'm doing that. And nothing's changing. I'm actually feel worse than I did before I even started taking the medication. And so in that stance or that case, like you as a practitioner would say, let's at least test for the Hashimoto's, because then we can make some lifestyle, we can do some other things that would be corrective or at least preventative from the destruction.
Absolutely, yes.
Beautiful.
We will definitely check for Hashimoto's disease. And then, we'll make the stepwise protocol to kind of figuring out why they got Hashimoto's disease and what they can do to kind of reverse it in a more natural way.
And are there, two different questions. So let's just talk about the thyroid in general. Why does it seem to be so fragile? That's kind of a crazy thing. I'm being a little bit dramatic, but it does seem to be fragile. Like a lot of people come to me and say, Jay, I've got a thyroid problem. Jay, my thyroid is blank. Jay, I have a horrible thyroid. So why is the thyroid so fragile in humans? Like, or is it not?
So actually, the course of thyroid has changed in several decades that we have known about it. So the first thyroid diagnosis we got, which was hypothyroidism, was actually because of low iodine. So people around the world, especially in pockets of areas, did not have access to iodine. And that's the reason they got hypothyroidism. So we were smart. We thought, well, let's get everybody iodine so that we can remove this problem and the thyroid problem will be vanished from the world. Well, that did not work. So it actually so the iodine supplementation is good. But then now, presently, the current reason of hypothyroidism, the number one reason is Hashimoto's disease. So we changed from iodine deficiency to Hashimoto's disease. And that's the reason, the incidence is skyrocketing. And this is all because of the environment that we have put our body into. There are several things which have changed into our environment. Our food has changed, our toxin exposure has changed, our stress levels have changed, different kinds of infections have come up. All of these together actually has created this perfect storm for the thyroid gland. So yes, you are correct that thyroid is fragile. Our body is because the thyroid is also the most important, one of the most important glands. So without thyroid, most people don't know. If we don't have thyroid gland, we will not be living.
Right. That's what I wanted you to kind of explain that, because I think we've talked about the thyroid, but what is it? Why do we have it? What do we even need it? Where's it at? Like, give us because I think a lot of people are probably thinking like, is it up here? Like, where's it at? I'm reaching for it. Like, they know it's somewhere around here, right? They're, they always touch their throat. So what is it? I mean, what's its, like, in a beautiful world, like, what's its main function? Why do we even have this thing?
Great question. So thyroid is a butterfly shaped gland which is located in our neck. Okay. So it's a very small endocrine gland. The job is to produce thyroid hormone. Okay. But this thyroid hormone is basically life giving to our body. Each and every organ, each and every cell of our body needs thyroid hormone. As I said, if we don't have thyroid hormone, we will not be living. There are conditions which are very acute conditions where people do not have, because of some genetic and congenital problems, they do not develop their thyroid and suddenly they land up in the hospital and sometimes they can die because their thyroid is not producing any thyroid hormone. And that is very life threatening. Okay. Obviously, most people don't have it, but I'm just saying. So starting from when we are actually developing in the womb of our mothers, we need thyroid hormone. If we do not get enough thyroid hormone when we are actually developing as a womb, our brain doesn't develop. So brain needs thyroid hormone. For developing, when we are an adult, for proper functioning of the brain, also thyroid hormone is needed. And that's the reason people get brain fog when they don't have proper thyroid hormone functioning. Our gut function also need thyroid hormone because, gut cells are very receptive to thyroid hormone. So all that peristalsis, the movement of our bowels are responsible for thyroid hormone. Our immunity needs thyroid hormone. Thyroid hormone is a metabolic hormone, right? So it runs the metabolism of our body. Right? So we feel energy because of thyroid hormone. We feel warm because of thyroid hormone. Then our nails, our hairs, our skin needs thyroid hormone. Without that, we get dry skin. We have brittle nails, our hair starts falling. For reproduction, we need thyroid hormone. A lot of people are actually, we have a very big rise in infertility issues, right? And that is again because of Hashimoto's and thyroid hormone, because that is needed for that. So literally each and every organ of our body and every place thyroid hormone is needed.
Yeah, this little butterfly shaped gland's pretty big deal.
Yes, it is.
What is the association? Because I think the probably number one and number 1A, like when somebody comes and says, gosh, I think I may have a thyroid issue. It's usually because of weight gain. Because that's like one of the things that people want to, kind of associate having a dysfunctional thyroid with. And then the brain fog. So I kind of like to touch on both of those. Like, what is the association to weight gain and a thyroid that's not functioning correctly? And I think a lot of times people say, well, I'm gaining weight because my hormones are off. Like, what's the association? Like, or do you actually gain more weight on, just naturally, or is it we're not processing the same foods we used to be able to process, and therefore we're gaining weight because of that? Like, what's the correlation of the association there?
So that's also an interesting point because, like initially, like there was a totally like, misunderstanding of how thyroid affects weight. Okay. So because, like, as I said, the thyroid basically affects our metabolic machinery. So there is something called basic metabolic rate. What BMR means is that, when we are not doing anything, when we are not doing any activity, our body needs certain amount of energy, right? And basic metabolic rate is the one which decides how much energy we need, every time when we are awake or even when you're sleeping also. And thyroid controls it. So people thought, or even doctors thought, researchers thought that when people have low thyroid conditions, so low thyroid means low BMR, and that is the reason people gain weight. But then the logic says if you replace that thyroid hormone, then all those people should lose the weight, but that doesn't happen,
Right.
right? So now we realize it is not an association of just with the BMR. It is actually much more than that. Thyroid affects your mitochondria. Mitochondria is the actual one which actually is responsible for burning all that fat, burning all the fuel. And mitochondrial dysfunction plays a very cornerstone in terms of because people are not able to lose weight. Thyroid also causes inflammation in the body. When your body is inflamed, it doesn't want to lose weight because then body feels that we are under attack or we are under threat. So I want to conserve all this energy, right? All this fat because I will need to use it when somebody is going to attack me, right? So that inflammation is also very important driving factor that people are not able to lose weight with thyroid. And then hormonal cascade, right? So people do say that, their hormones are out of whack, which they might be thinking about thyroid hormones, but in reality, it is all the other hormones. The two main hormones are actually insulin and cortisol. Most people with thyroid disorders have insulin dysfunction. What that means is that they have insulin resistance. Their body is not able to utilize the insulin in their body. And that's the reason they are not able to lose weight. And second thing is they have cortisol excess. Whenever there is excess cortisol, cortisol is basically a stress hormone, right? Whenever a body gets stressed out, teeny tiny glands, adrenals secretes this cortisol. Now, in acute phases or for short amount of time, this cortisol is useful for a body, but on a long-term basis, this cortisol is actually detrimental for a body because this cortisol again doesn't let thyroid hormone do its job and insulin not do its job. So all that weight around the belly that a lot of thyroid patients have and not able to lose it is because of that cortisol.
Okay, you've just described like a multi-phase or a multi-step situation, right? So we've got our lower, we'll call it lower energy, our metabolism, our fire is a little bit not as strong as it needs to be to burn the calories. Then we've got a mitochondrial issue, which is a whole other conundrum that most people probably are going to have trouble wrapping their head around. Then we've got the inflammatory issue of just, the body. I always say this, an inflamed body is not interested in how you look in a bikini. Its number one job is to decrease that inflammation and get you back to homeostasis. And then lastly, you've got that cortisol scenario, right? So what I see like from this side of the table is when a client gets put on these things, they just get handed a medication and say, hey, good luck, go out there. You're going to be okay. And they're not okay, right? Because the medication isn't elevating the metabolism. It's not fixing the mitochondrial issue. The inflammation is still there, and we still got the cortisol scenario. So how does the average person, I mean, obviously we're going to get your book, we're going to read that, but how would the average person even know that? They just think, oh, it's my thyroid. Here's my medication for that. They don't think about that multi-step process that has to be addressed, because even if you address one of those, you still have the other three that are massively important. I'm assuming that's kind of like what your protocol kind of addresses, I hope.
That's correct. Yeah. And that's actually the sad story, which is such a big, sad story that most people have no idea. Most of the thyroid patients, the research actually shows that more than 70% of people who have thyroid issues are taking medications and their blood work are within the normal range of what they should be, still continue to have symptoms of thyroid disorder.
Yeah.
So this is alarming, right? Any medicines you want to get better. That's the reason you're taking a medicine.
Yeah.
It is not working in majority of the people. That's very disheartening. So most people have no idea. They have been going to doctors and doctors, and again, most of these are females. So what happens is that, females get shunned down very often. Oh, you are a mother. Oh, you are, like a daughter. Oh, you're taking care of your household. You're juggling so many different hats. That's the reason, you're not able to lose weight or you're just too stressed out, right? So most of these people, they're asking questions, but they're not getting answers. So that's a very sad piece of it. Until like, they start researching, like maybe listening to a podcast or like, some other videos or maybe reading a book. That's where they know actual problem. And then they start making changes to their lifestyle. What is the right diet? Again, there is so misconceptions out there about what is the best diet. Everybody
Yeah.
is like, have a different diet, and people have tried all these low calorie diets, which actually hurt the thyroid gland. So a lot of people don't even know what is best for thyroid and what is not.
Yeah. And I think along the female thing too, when they go, then they get hit with, oh, well, your early onset menopause, your estrogen is out of whack, you're not producing enough progesterone. So then they hit them with all that, which just
Mhm.
confuses them even more. So now they've got the whole, the Hashimoto's thyroid situation. Then they just got hit with the menopause and the other hormones. And it's like, what do? You know what I mean? So then the confused mind says no. So they just tend to not do anything and except for suffer. And so I think that's a great transition. Like when you just said that about nutrition, right? Nutrition, lifestyle changes. Like one of the questions that I want you to answer is, can someone improve their condition? And I'm not debunking medication at all. I think medication is necessary when it's necessary, but sometimes it's not a standalone. So are there lifestyle modifications and movement modifications and food and all those things that are beneficial to anyone who has a quote unquote thyroid situation?
Absolutely, yes. We have so many research studies which support this notion that, there are diets, there are food plays a very important role, exercise plays an important role, stress management, sleeping better, all of those things are very, very important. And again, you point out a very important topic about medications. Again, I am not against medications either, right?
Oh,
Because again, I'm a conventional doctor. So yes, medicines is not your enemy, but
hmm.
what beyond medications, right? So if medicines are working, if you're happy with it, okay, well, that's fine. But what if you are that person, you are that 70% for that the medicine is not working,
Right.
right? You're not able to achieve the highest level of quality of life that you deserve. That's where all of these things, very, very useful, right? So lifestyle changes definitely is the cornerstone or the basis of our protocol that everybody should be doing it, and that creates great results. And then after that, definitely you can do advanced protocols. We want to use the supplements and other things.
I think one of the things that just hit me is I think, you go to the doctor and they say, well, hey, you've got this thyroid situation. If you lost some weight, it would help you. Well, that's why I'm here in the first place, doc. I can't lose the weight. I wouldn't be here if I didn't have that problem. So it's like, it's telling them to do something that they already want to do. And like you said, they've thrown everything but the kitchen sink at it, every conventional mass marketed diet. Like some people have tried even the fringe diets, if you will, of, go into the extremes, not because they're crazy, because they're just tired of suffering and they'll try anything. Like if you take somebody who's suffering and you're like, hey, only eat hard-boiled eggs for 30 days and you'll be fine, they'll eat hard-boiled eggs for 30 days just because they don't want to suffer. So I think there's a confusion in that metric is like, if you lose weight, you'll feel better, but good luck losing weight. So how do you handle that when a client's sitting or a patient's sitting across from you and you have to have that conversation? Like how do you handle that?
So again, just explaining to people, like I see these things day in, day out, right? People start working with us. Like an example is this, like, lady I'm working with currently, very like nice 35-year-old female, like who has been struggling with weight issues for more than 10 years. After her first pregnancy, she just gained weight, was not able to lose it. Again, like doctors kept on telling her, oh, this is a baby weight, just stressed out with a new baby. Then later on, oh, you're juggling between your work and your personal life. She was just not able to lose weight. She kept on telling them something was wrong, right? They kept on only checking TSH, nothing more than that. Obviously, the TSH was not quote unquote normal. So she just kept on like kind of living her life. Later on, she started feeling more tired, more fatigued. She started having gut problems like constipation, bloating. Again, she kept on going to the doctors, but her TSH was normal. So they could not do anything. She was referred to psychiatrists. She even tried psych medications. That actually made things worse. So she stopped the medicine. And then finally, after 4 years of suffering, her thyroid TSH did came back abnormal. So she was actually finally relieved that something is
Yeah,
wrong
she's
with
like, thank
me.
God, finally, I got a bad number.
Exactly. So she started on the medicines, nothing changed. So she was totally disheartened, like, okay, well, why am I not getting better? Her doctor increased the dose of medicine, but nothing changed. That's where she started researching online. Hey, what's going on with me? Somebody said, well, maybe you might have Hashimoto's. Go check it. She told the doctor. Initially, she was said, well, even if you have Hashimoto's, our protocol is not going to change. So why you want to waste money? She said, no, I want to check it.
Yeah.
So she checked it. Obviously, she had Hashimoto's disease, but then they said, well, I cannot do anything. She said, well, what about diet? Nothing. Just go home, eat what you like. So he said, okay, that is not working. So he started researching more and more. So again, like, because her weight was not coming off and she was very miserable because of that, she went on a very, very low calorie diet, 800 calories a day. That's what she was eating.
Oh my
She
gosh.
did that diet for like, 3 to 4 months. She fainted in that time 4 or 5 times. She hit her
Sure.
head a couple of times because of
Oh,
that. But still, she wanted to lose weight.
yeah.
She lost only 5 pounds with that doing that diet. And she was totally confused. Her doctor said, well, you cannot do this diet. That is harming your body. She said, well, then help me. And he said,
Yeah.
well, I cannot do anything beyond this, so you are on your own. That's where, like finally after doing these for several years, she said, okay, well, let me start doing functional medicine. She found us, she started working with us. So then I tried to explain to her, like, actually the low calorie diet is not good for you. And I told her that instead of focusing on the calories, we want you to focus on the quality of the food.
Beautiful.
So we actually asked her to eat more food.
Oh,
And she totally flipped out. Dr. Gupta, I think this is a bad idea. I
yeah.
want to lose weight, and you are actually asking me to eat more food.
Yeah.
I've never eaten so much food in my life. I was like, I'm telling you to focus on the quality of the food, not on the quantity.
Right.
Just do this, trust me. Then we figured out other problems, like obviously because of this low calorie diet, her gut was not functioning. She was low in a lot of vitamins and minerals. So we started on some supplements to support that. And then just in 3 months, she already lost 11 pounds. So she was totally crazy by seeing that number. That was not a big number.
Right.
But she said, I'm eating what I want.
Yeah.
I'm eating more than I ever wanted, and I'm losing weight. This is not making sense. He said, yeah, this is exactly you need to know. Your thyroid and your body needs nutrients.
Right.
So we need to provide that. And again, just focusing on the calories doesn't work. So just when the whole machinery starts working, then we see results. Just focusing on one thing doesn't do that. And
Yeah.
that's what I tell people, like, it's complicated affair. Our body is just not one organ or the other organ. It's all connected.
Yeah.
So when we start working on the whole body approach, whole nutrient approach, that's where people get results.
Gosh, I want to give her a hug. I feel horrible. I mean, can you imagine, like, you get to a place where they make you think you're crazy. And so, well, now she goes and sees a psychiatrist, gets put on probably another something else was just going to harm her, an SSRI that she doesn't need. It's like, oh my gosh, this poor thing. And then you tell her to eat more, and she probably wanted to fight you. But I think that's the misconception too. There's a lot of, like, the internet is an amazing thing, but it's also a crazy thing because there's so much noise out there that when you told her to eat more, her brain went to, donuts and pizza and burgers and fries and McDonald's. And she's like, I'm going to get fat. And so there's a disassociation between, like, eating more and the quality and eating more in a quantity aspect. Right. So I think what you and I are both prescribing and trying to teach is, like, quality is everything. I always tell clients, like, nobody's ever gotten fat eating broccoli or eating asparagus or eating lettuce or eating, or protein and like really normal natural foods. And I don't know if what do you believe the association of this is? I read something the other day, and I can't remember where I read it, so don't quote me on this, anybody, that close to 80% of our current nutritional intake as Americans is from processed foods, like not even real foods anymore. It's like boxes and bags and, chemicalized things and whatnot. Like, do you see that when you start asking clients, like, hey, what does your normal intake look like?
Absolutely. Yes. We are living in a culture or in a time where like processed food is like entered into each and everybody's house.
Yeah.
And that's quote unquote normal for most of the people. So for them to kind of start changing, a lot of people don't even know how to cook. That's kind of the biggest issue. They have never cooked, so they don't know how to cook. So sometimes we get into this trouble that we have to give them cooking classes to actually help them to understand, because you cannot rely on outside food all the time.
No.
And obviously, I don't mean that, like you leave your busy life or your busy careers and then you just focus on like, spending all the time in the kitchen. That's not practical. So,
Right.
but you can still cook food. You can manage your life very easily. There are a lot of different recipes which can be like, made very easily, batch cooking, which can be done over the weekends. So if you just need a little bit of a planning and a little bit of ways how to cook things, and amazing things can happen.
Yeah.
So again, like a lot of people have this myth that, oh, I cannot do this program or this protocol or anything else
Right.
because I just don't have the time. I need to focus on my career. And I tell people, well, all majority of our clients are high achieving clients because they want to get to the best of their health potential. So obviously they are busy too. So it is a very easy thing and very easily manageable.
You know, you and I are teaching and preaching the same thing. And I think a lot of times when people think like, because I'm doing the same thing, I'm trying to teach batch cooking and, you know, make big portions and keep it simple. I think a lot of times when somebody says cook, they're like, well, I don't want to mince, you know, garlic all day or, you know, grow my own herbs in the backyard. Like no, nobody's suggesting that, right? If you don't love to cook, you got to just keep it simple. But I think that one of the key takeaways is like the more you can just stay close to the source, right? Like what Mother Nature intended, I think the better off your body is going to respond. And a lot of times what I see is that the people that are having some of the issues, it's that they have succumbed to kind of like the fast food society that we live in, right? Everything's at a click of a button. Like we can push a button and somebody will bring the food to my door. I don't even have to get off my couch anymore. And so we've kind of succumbed to all of that. And then I think on the flip side, what do you see from a time frame perspective? Because I mean, we are now a society of like, I wanted it yesterday. And doc, if this doesn't work by Friday, I'm not going to be able to do it. And you don't know what you're talking about. So and I'm saying this all in jest. My audience knows that like I'm a consistency commitment over time. Like we got to look at the time horizon. No, nothing that happens quick is going to happen forever. So what is the time horizon for when somebody says, you know, kind of started following your protocol of, hey, I've got this issue. When do you start seeing changes?
So yes, it's definitely a long run, right? Because, as you correctly said, like it's not a 100-meter sprint. It is a marathon.
Yeah.
We have to run the marathon. So absolutely. But the good part is that, people can start seeing a shift very quickly. Within like 4 to 6 weeks of starting the protocol, people start seeing a shift of how their body is doing. And generally in second to third month is a magical month is what I call them. Because second to third month is where people start feeling really good. Like, they have more energy, they feel just their mood is better, they start losing weight, the gut is better, their brain is working good. So second to third month, definitely a lot of changes are happening. But as soon as 4 to 6 weeks, people will start feeling some change. Well, I think I'm getting more better days than bad days. So it works quickly and then, start seeing results, also. But yes, it is not going to happen tomorrow or it is not going to happen in a day. 4 to 6 weeks definitely is needed. And probably like 3 to 4 months is an ideal time to kind of see a good amount of change, which can definitely be more perceivable and that can change your life very quickly.
Beautiful. I got a couple more questions for you. I want you to wrap it up with telling me what the protocol you would start with. So if you're somebody who's listening, what would be the first step, right? Go get the blood test, follow up with this, read the book, that type of thing. But I want to ask a question before that. Is there anything that we should be doing just as humans to protect our thyroids, to keep them healthy? Because I think the thyroid gets, it's like, what is it? It gets overlooked a lot. People are always thinking about your kidney health and your liver, and you don't have fatty liver, blah, blah, blah. And, you get a lot of like messaging around like, eat this for a healthier that. What can we do to fortify or to, and again, some of these things are out of people's control, but what can we do to kind of to make our thyroid happy, if for lack of a better term?
So again, like you correctly pointed out, going back to the nature. So everything which we are supposed to do in the nature, we will do it, and that will support our thyroid. So in that aspect, food plays an important role. So all that processed food, which is not part of the nature, just throw it out. It is not helping your body anyways. That is toxic for your thyroid. Eat real foods, a lot of vegetables, good quality protein, good quality fats, right? All of those things are very, very important, supports your thyroid gland on the daily basis, gives it all the nutrients that your thyroid needs to function. So food is a very cornerstone. The second thing is body movement, right? We are made to move our body. We are not supposed to be couch potatoes. The corporate world we are living in, yes, we have to sit like for long hours. Everybody's doing it. And I'm not saying that throw away a job, but you can find a couple of minutes, right?
Yeah.
5 minutes, right? Just set an alarm after every hour. You just, stand up, go for a walk. Takes maybe a couple of minutes. Nobody's going to stop you doing that, right? or a workout wherever you can. So body movement is very, very important, right? So that's the second thing. The third thing is stress management. We are living in this world. We are bombarded with a lot of information, a lot of chaos is happening, a lot of things is happening. It is very difficult for our small mind and a small body to process all of this stuff.
Yeah.
Again, that doesn't mean that go into live in the forest or go like, live in the mountains, like that is not going to be possible. We will get bombarded. So we need to prepare our body to handle that stress better. So inculcate some de-stressing exercises like meditation, yoga, a hobby, or like, a walk in like, in the forest or the nature. All of those things are very important, very rejuvenating for our body. And again, that will reduce the inflammation by reducing stress.
How about sleep?
Sleep. And that was the next thing.
Okay, good.
And the last thing is the sleep, right? Again, research is very clear. More than 60% of Americans are not getting good quality sleep every night, right? And we know that sleep is very, very rejuvenating. All that stuff that is happening in our body during the day, that all that stuff needs to be taken care of in our sleep. Our immunity gets taken care of the sleep, our rejuvenation of the cells, rejuvenations of our body system, all of those things is happening. So very important to prioritize of sleep, 7 to 8 hours, and then plus good quality of sleep. So these are the basic things. And the last thing is the toxin-free lifestyle. Because our thyroid is very, very sensitive to toxins, and we are getting bombarded with each and every day more and more and newer toxins, artificial things, especially again females, right? Because they're using so many body products each and every day before they leave their house. And what females don't know is that even though they're using it on the skin is the biggest organ of our body. Everything that you put on the skin do get absorbed in the bloodstream and go to your thyroid gland. So again, using less of the products, and plus looking at your products and maybe finding more natural alternatives or products which have least amount of toxins. So these are all the things which we do those things, they are definitely going to safeguard our thyroid gland a lot.
Very smart. How does, how does like obesity and excess weight play into thyroid function? The more, obviously, I think there's a health perspective that comes along with that, right? Is there an association between having excess weight, carrying excess weight, and then your thyroid functionality kind of diminishing?
It does. Yes, we do see that, people who are a little bit on the overstate, especially obese side, their thyroid levels are lower as compared to like, a person who is not obese. And again, like the reasoning behind is again, that whenever you're obese, then your insulin levels goes very high. You have insulin resistance going on. And as I kind of explained to you how thyroid affects insulin resistance, same thing happens. Insulin resistance also causes thyroid problem. So it's like a two-way street, which is happening. All the hormones in our body are connected with each other. So if one affects the other one also affects it the other way. So that's the reason insulin resistance affects the thyroid gland, doesn't let it produce enough thyroid hormone. And again, like the amount of thyroid hormone that is needed in our body is more, because again, our body cells also becomes resistant to the thyroid hormone also.
Perfect. So I think anybody, like I'm a nerd, like I think anybody should know as much as they can about the human body. So I think getting your book, Reversing Hashimoto's, would be a first step for anybody who is concerned and or just wants more information about how they can stay healthy, get healthy and whatnot. So how would you prescribe to somebody that was listening right now that you and I may never even get to talk to? Like what steps should they take if they feel like something's just not right? Like this weight won't come off. My brain is not what it used to be. I'm exhausted all the time. Like what's the step-by-step process you would do?
I think getting first complete thyroid testing is very important. Okay. And again, like, if your provider is not very keen on doing it, just explaining to him or her that, you're really interested, you're very suffering. And I think most of the providers, are concerned about their patients, and they, like they're open to ordering it. Sometimes they might not be open to ordering it on the first go, but if you explain to them, like you want to get tested, they will be. And then if you do have that problem, let's say if you have Hashimoto's or hypothyroidism, then looking to the next step of what else you can do, right? And in that aspect, lifestyle changes are the cornerstone. So start changing your lifestyle today itself, what you're eating, how you're eating, all the things that we discuss about stress and kind of, exercising and things. And it's also very important to find the root cause of the problems, right? Because what we have understood is that, like thyroid or Hashimoto's is multifactorial. The way we understand is that, most of the time, the number one reason 100 years ago where people will die was because of infectious causes. That means, you got a pneumonia in your lung, and, there is a particular bacteria which caused that pneumonia. And if you treat that bacteria, we get better and everything is okay. That is monofactorial, that is unifactorial, that one factor, bacteria, caused that particular disease. The current scenario is that there is not just one reason of getting Hashimoto's, it is multifactorial. Multiple factors together come along and cause a disease. So try to figure out where all those factors are playing a role, whether your food is not good, whether you're not sleeping enough, whether your toxin exposures, all those things will be first step to figure out where your body is not working and start working on those.
And then if you are going to let's just call it a conventional, medical practice and you've tried things and it's not working. It's just, you're just continuing the medication, nothing else. So would you suggest like looking into finding like more of a functional medicine practice similar to what you guys do?
Absolutely. Yes. If, again, as I said, if you're not happy with the medicines, or if you still have continuous symptoms, even if you have medicines, or if you just want to reach that highest potential, then definitely looking for a functional medicine provider will be very important. I mean, a lot of people are doing virtual consultations. So we actually virtually consult people from all over the country.
I was going to ask that. Good. Yeah.
Yeah,
so
so
tell everybody how they could reach out to you or your clinic and get some more information if they were interested.
Absolutely. Yeah. So the best way to actually reach us is our website. Our website is anshulguptamd.com, which is spelled as ANSHULGUPTAMD.com. That a lot of information is over there. We have a very active blog. You can read and understand what we do. And that's where, people can actually avail also consulting call with us. So that's a way to do that. We share a lot of information. So obviously book is out there. People can buy it, Reversing Hashimoto's, which is available on Amazon. They can buy the Kindle version or actually get the book. But I have a very active YouTube channel. The handle is again Anshul Gupta MD, where we again share information, a lot of videos about what you can do today, that can improve your Hashimoto's in your thyroid gland. So these are great resources. People can learn more and understand more what is going on with them. And then if they need our help beyond that, that's where they can, go on our website and request a consultation from wherever they are, and more than happy to work with them.
I love that. I love that. That's so awesome. And I've checked out all your resources. They are absolutely phenomenal. And I will link everything in the show notes, guys. So just in case you're driving, don't get in a wreck. Like, it'll be in the show notes. I'll put all of Dr. Gupta's website, YouTube channel, everything in there, so you just can click it and watch it. Doc, I got smarter today, and I'm actually a little more. I don't know if the right word is. I feel better about the medical world that we're living in, because I think there's people out there like you that are really focused on helping people not have to suffer and not have to just be on a medication that's not working. So thank you for coming on today, and thank you for doing what it is you're doing.
Absolutely. It's a pleasure. And it just kind of overwhelms me when we see these stories of people who are suffering for a long time.
Yeah.
But I always tell people, there is hope for you to get better. Don't let anybody know, or don't let anybody tell you that there is no hope for you to get better. If you're not better, that means there is something out there that you have not yet done that can change your life. So keep looking and find the right resources and the right people to work with, and definitely you will reach your health goals.
Dr. Gupta, I love it, man. You're a rock star. Keep doing what you're doing.
Thank you so much.
All right, we'll see you soon. Hey, before you go, I'd just like to say thank you again for listening to the Thrive Forever Fit podcast and watching on YouTube. It means the absolute world to me. And if you would do me one favor, and that is simply subscribe and review this podcast on whatever platform it is that you enjoy it on, YouTube, Apple, Spotify, doesn't matter. I would absolutely be so grateful and so thankful if you do that for me. Thanks again for listening, and I'll see you again next week with an awesome episode. Bye.